forensic mental health is quite a specialized field, and research methods also have to be specialized. We're dealing with patients with serious mental disorders who also have committed serious offenses, and it's imperative that we evaluate what we do, the interventions, the outcomes, the patient experience, and so forth. And so this course really was aimed at building capacity in research, and it offered a range of different methods. We've put together a range of study visits, networking events, and workshops. So, for example, today is the last day of such a workshop, which is part of an extended visit from 6 Egyptians here to Nottingham. As part of that visit, they have had a workshop on research methods in forensic psychiatry. They will also be able to visit a forensic conference and visit some institutions here that treat forensic psychiatric patients to get some exposure to the practices in this country.
It was very interesting to attend this course because it's not common to find a course to talk about research from forensic perspective, and this was the first time I come across a course like that.
The research methodology to formulate a research question and type of study should be used, sampling of patients, data analysis either for qualitative and quantitative data.
But I think all of the presenters were really good at making it relevant to us and our learning, discussing with people as well, being inquisitive themselves about what areas people worked in and how that could apply.
Also regarding the patients, how they help in research, and this was wonderful for us because at our country patients are not participating in research work, only they are participants in the research, but they are not helping us.
The concept of ethical views and how ethical committees work here, and the concept of patients' rights, patients' needs, and how to construct a research based on what the patient actually needs, not on what we as researchers need.
It's becoming very apparent with our Egyptian colleagues that are here, there's so much to be done cross-culturally, and the things that can be expanded on in different cultures, and how culture impacts upon the work we do. And I don't think there's been enough done in that area, and that's been quite evident this week, I think.
I haven't decided yet, but at least now I know more about something like qualitative research. I didn't know about that before.
I've developed so many ideas. Already I've had some, on the short-term plan, I have some research that I'm really interested to replicate back home in Egypt. On the long-term plan, I'm thinking of training so many other psychiatrists back home on what we took in this course, how important it would be just to have a different view of different practice than what we do.
The stigma of patients, we are so much stigmatizing forensic psychiatric patients per se. So I think this is the research that I will conduct later on.
The idea also of not discharging patient from high secure hospital direct to the community, as we didn't have these levels, high and medium and low, just from the hospital to the community. I think this will be more beneficial for patients.
Behavioral therapy and to compare it with the medication and some sort of disorder that we usually see in forensic setting. So, and I would be able to maybe do it in more than one location, like Hull Secure Hospital in the UK, something like that.
The rehabilitation for those patients to be part of the community again. This will be the main idea of my research if I have unlimited funding for this.
A prospective cohort study for following patients, starting with a violent risk assessment for them and following them through their stay in hospital and even after their discharge, just making a follow-up plan.
I would consider a mega study with lots of participants regarding forensic psychiatry. I would go with child and adolescent psychiatry, especially that putting the child and adolescent psychiatrists in forensic setting, a long-term prospective study, seeing their family dynamics, how would they interact, the outcome of those children, hopefully reaching where they go back to normal functioning in life.
The social aspect of those patients. They lack all social support and all social services. This may help in rehabilitation of those patients back to the community.
And the collaboration between forensic department and psychiatric department with our team here in Britain, I think it will be good.
There are actually so many research challenges in Egypt. We don't have so many people really aware of what forensic means, the attitude and the stigma, and really negative towards psychiatric patients and forensic patients especially. So we have so many challenges to overcome.